Now, the factors that influence your cholesterol are things that we should know about. And one of the factors is the amount of saturated fat. And most animal fat is saturated, whereas the vegetable fat is unsaturated or monosaturated. So you have to avoid the animal fats.
What if everything you thought you knew about cholesterol was wrong? For decades, doctors, hospitals, and even government campaigns have warned us high cholesterol equals heart disease. But here's a shocking truth. Half of all heart attacks happen in people with normal cholesterol levels. Dr. Ellsworth Wareham, a world-renowned heart surgeon who lived past 100, spent his career questioning this medical myth. So is cholesterol really the villain, or is there a deeper story that has been ignored for decades? Today, we uncover the dangerous truth about cholesterol that every senior needs to know.
For years, millions of seniors have lived in fear of one number, their cholesterol score. If it's above 200, panic sets in. Doctors prescribe statin drugs, patients obediently swallow them, and everyone believes the problem is solved. But what if lowering cholesterol at all costs is a distraction? Research shows that despite billions spent on cholesterol-lowering medications, heart disease remains the #1 killer worldwide. Even worse, many people on statins develop muscle pain, fatigue, memory loss, and even a higher risk of diabetes. Yet they continue, believing the pill protects them. The real tragedy is that focusing only on cholesterol blinds us to the true culprits: chronic inflammation, oxidative stress, and metabolic imbalances. Ignoring these root causes means seniors risk heart attacks, strokes, and diminished quality of life despite perfect cholesterol numbers.
Cholesterol itself is not a poison. It is a vital molecule your body cannot live without. Nearly every cell in your body contains cholesterol because it forms the backbone of cell membranes, keeps them flexible, and helps nerves transmit signals. It is also the raw material your body uses to make hormones like estrogen, testosterone, cortisol, and even vitamin D. In fact, your liver produces about 80% of the cholesterol you need, regardless of how much you eat, because life simply cannot function without it. So why did cholesterol become the villain? The problem isn't cholesterol itself, it's what happens when it becomes damaged. When LDL cholesterol particles are small and oxidized, they can penetrate the artery wall and get stuck, especially if the arteries are already inflamed. Imagine patching a crack in the wall of a dam. Cholesterol rushes in to repair damage. But if the wall keeps cracking from constant stress, high blood pressure, high blood sugar, or smoking, the patches keep piling up, creating a blockage. In other words, cholesterol is more of a firefighter arriving at the scene, not the arsonist starting the fire.
1. Believing cholesterol is the enemy. Many seniors panic when they see a high cholesterol number and assume heart disease is inevitable. In reality, cholesterol is often just a bystander, not the true cause of heart attacks. 2. Relying solely on statins. Statin drugs can lower numbers on paper, but they do not fix the underlying problems, like chronic inflammation or insulin resistance. Worse, they may create a false sense of security, leading patients to ignore lifestyle changes that truly matter. 3. Ignoring hidden risks. Over 50% of heart attacks occur in people with normal cholesterol. That means other factors, blood sugar, blood pressure, triglycerides, and inflammation, are being overlooked when doctors focus only on cholesterol levels. 4. Falling for changing definitions. In the 1980s, cholesterol under 300 was considered normal. Today, the cutoff is under 200. These shifting targets have turned millions of healthy people into patients, fueling unnecessary dependence on medication. 5. Overlooking lifestyle impact. Diets high in sugar and processed oils, lack of movement, poor sleep, and chronic stress all damage arteries far more than a single cholesterol number.
Solution 1. Focus on inflammation, not just cholesterol. Instead of obsessing over a single blood test number, Ask your doctor about markers like HSCRP, a measure of inflammation, triglyceride to HDL ratio, and ApoB. These give a far more accurate picture of cardiovascular risk. Solution 2. Choose anti-inflammatory nutrition. Fill your plate with colorful vegetables, leafy greens, legumes, nuts, seeds, and omega-3 rich fish like salmon. Replace processed oils and fried foods with extra virgin olive oil or avocado. Limit sugar and refined carbs, which drive insulin resistance and artery damage. Solution 3. Move your body daily. You don't need a marathon. A brisk 30-minute walk, light strength training, or even dancing in your living room can lower blood pressure, improve insulin sensitivity, and raise protective HDL cholesterol. Solution 4. Manage stress and sleep. Chronic stress raises cortisol, fueling inflammation and blood vessel injury. Daily practices like deep breathing, prayer, meditation, or Tai Chi calm the nervous system. Aim for 7 to 8 hours of restorative sleep. Your arteries heal when you rest. Solution 5. Avoid toxic habits. Quit smoking completely. It directly damages artery walls. Limit alcohol, which raises blood pressure and oxidative stress. Even moderate drinking adds to long-term heart strain. Solution 6. Reframe your mindset. Instead of fearing cholesterol, see it as one piece of a bigger puzzle. The goal is not chasing lower numbers at all costs, but creating a healthy internal environment where cholesterol can do its job without becoming dangerous.
Cholesterol was never meant to be feared. It is a vital part of life. The real threats to your heart are inflammation, oxidative stress, and unhealthy habits that silently damage your arteries. By shifting your focus from chasing numbers to healing the root causes, you can protect your heart, regain energy, and enjoy more healthy years. Remember, you are not powerless. Simple changes in diet, movement, stress, and mindset can transform your future. If this message helped you see cholesterol in a new light, subscribe to Healthy Senior Life, Dr. Thomas. Share this video and join our mission for lasting health.